and action. Welcome to today's episode. Today we will start a new series about health. Today we'll be taking a bit deeper dive into the topic that is mental health.
Delving into a very small fraction of mental health. It's such a broad area. The least we can do is just take a step in that direction at least, because it is something that is very real and it's affecting quite literally anyone we know. So I think we should just go full ahead and get into this, man.
Without any further ado, my name is Brendan now.
My name is Llewellyn Visser, and you're listening to Finding Ball.
Roll intro. Well, mental health is a very broad topic. There's so many elements to it, to a much larger spectrum. I think to start us off, I think we should maybe discuss, what is our personal understanding of mental health? I don't know, like, how do you view mental health?
Okay, yep. If we're just going, blindly into this, not having done any research before this podcast, before today, I feel like mental health, and in particular mental health issues of any sort, would be a chemical imbalance in the brain, and it would be behavior that is not considered natural or normal, or it's something that is defined as strange, or you're an outcast. That's what I think a mental health issue is, going into this blindly, like disregarding anything I ever knew or thought. And then if we're talking mental health itself, well, that's obviously psychological. It's in the brain. It's something that it's immaterial. It can't be touched, seen, felt. It's just, the greatest mystery of the human body. Back in your court, what comes to mind?
Well, mental health, I feel awareness for it has definitely increased over the last decade or so, as does cases regarding mental health has also increased throughout that time. But I think mental health is one of those things, it's a very easily treatable thing, it's a thing you're not supposed to drag along with you. Definitely, I feel if you don't treat it immediately and you carry it with you, it can become quite severe and quite bad and lead to many, unsavory consequences. Like, for example, mental health is probably one of the most bad mental health is probably one of the most leading causes of, suicide, especially in youngsters. I mean, if you take it, the World Health Organization states that actually the fourth leading cause of death in people between the age of 15 and 29 is through suicide. And with mental health playing such a big role in leading to suicide. Obviously, suicide is obviously an entire different topic, but it's very severe. I think if you do not treat mental health and you carry it with you, it can sort of become, to give it like a comparison to something like, for example, are you aware with parasitic wasps? Now, for example, a parasitic wasp would lay like eggs into, for example, a caterpillar. And on the exterior, a caterpillar would seem 100% fine and dandy. But what's going on inside him is, essentially larva that's being hatched inside him, eating him from the inside. And eventually it goes for his vital organs, and it's a very slow, painful death, as with bad mental illness. If you don't treat it, you might seem all fine and dandy on the exterior, but inwards, the suffering can sometimes be unbearable, leading to, unfavorable things like suicide. So definitely, I think with the oversimplification, if I put it this way, is to treat yourself. Definitely, like, talk to someone, see someone, and like there's so many aids now, I find, definitely treating with mental illness, especially like in any work environment as well. They have got now aids to help you considering mental health. They've got mental health awareness months as well, which we had, like, I think a couple of months ago was mental health awareness month, if I'm not mistaken. Also, universities have lots of people as well you can talk to in different actually offices and things as well. I know, do you have similar things like that at your uni? I know you also work in your office. Like, how's mental health treated in Australia? Is it a thing that's created a lot more awareness over the years since you've been there? Like, you can obviously give us more on the topic there.
Yeah, like mental health is a really big issue in Australia. Like, I don't have any figures for you. I don't have the suicide rates or the statistics, but I am very aware that in a privileged country like Australia, where you have an infinite amount of options in which direction you can go. You can be a professor, you can be a student, you can be a laborer, you can be a McDonald's worker. Like, there's so many options that you can choose from, and you're so privileged, and you have this sense of entitlement that, yeah, like, it's overwhelming. And there are initiatives how to deal with poor mental health or mental health issues. There are we do have Are You Okay Day. There's this one day at the end of the year where we just take a moment to acknowledge that, yes, there are mental health issues in the workplace or in our local towns. Take the time to ask someone, are you okay? But yeah, as a student, I do feel that the presence of a therapist or a well-being team member is felt. Like, it is very overwhelming to be a student, and nevertheless to also be a full-time employee, and having both those in the mix, it's definitely a struggle. Like, I feel students are very resilient, you and yourself included. You take a really poor mark from a quiz and you have to go into an exam or another quiz or write an essay knowing that I failed my first step or my first test or quiz or whatever like that, and you still have to keep going. Like, that is harsh. You have to take criticism, you have to deal with personal matters. So yeah, like, me personally, at times this year I've felt overwhelmed too, and I felt like I've had no one to talk to. And I've tried going to the counselor at my university. And long story short, we were missing each other. She was busy on those days, I was busy on these days. Our schedules just overlapped, and I couldn't make an appointment, not because I didn't want to, not because she didn't want to. It's just life. So that's been rather difficult. So in saying that, I did read about there being a difference between mental health and mental strength. Now, the comparison here that I'll mention is that when you think about your physical health and your physical strength, so you could exercise for a certain amount of hours every day and you will build muscles. That's your physical strength. But these muscles have no way whatsoever in preventing you from becoming physically ill. So they have no way of, let's say, for argument's sake, preventing a cold or preventing any life-threatening diseases. There's this analogy where you have mental strength versus mental illness. So if you train your mind to be resilient in certain circumstances, then you will have this ability to better deal with certain struggles that could lead to mental illness. I obviously don't mean anything that can be diagnosed, such as, you know, schizophrenia or Alzheimer's. That's a matter of a lot of
And I
variables.
think
But
one of the ways that I find definitely to increase one's mental strength is through routine. I find if one comes into a good routine, you wake up at the same time every morning, for example, working, you're making an income, you know, you live a dignified, meaningful life. And I think also, I mean, Jordan Peterson also exclaims, you know, and also emphasizes the fact, you know, of the importance of living a meaningful and dignified life to combat suffering. So definitely, I find, if you can live a meaningful, dignified life through the means of routine and doing something, adopting responsibility and doing something, Also, Jordan Peterson also regularly says, it's one of his rules in his book. He says that you should think of yourself as someone you're responsible of taking care of. And that in itself creates responsibility. So definitely, I feel just adopting responsibility and just doing something with your life, getting out there, taking risks is also a big thing for me.
Well, I read that Krishna was one of the Hindu gods. He said that bad thoughts are like waves of the ocean. There's no way of stopping or combating these waves. They'll, regardless of circumstance, they'll continue to come. These waves will continue to roll over. And then they went into how they said that meditation is one way to deal with these waves, so to speak. And I do actually agree with Krishna. Now, you and I were both raised in conservative Christian households, so we don't know too much about the Quran, but this little 50-page booklet that I bought of some monk in Sydney taught me so much about spirituality. I felt that it's not so much, at least this booklet anyways, it's not so much about the actual religion or the gods itself, but more about mental health and meditation and how to deal with these, so to speak, waves.
Like you said, it's all about getting that rational thought pattern, not like exhausting your brain, thinking about irrational things like you can't control, for example, like illness and things like that, or car crash, bad health, bad finances. That plays a big part in things. I think getting that good, strong mental strength to know that, well, bad things and suffering in general are inevitable in life. The only thing you can really do is position yourself in a way that you can deal with as best you possibly can, and that it comes in with good mental strength. You can either wither with bad mental health, not get help, and actually, like as you gave the reference or the metaphor of the wave thing, you'll drown yourself. It's more of positioning yourself in such a way that you can see the wave coming and you can stay afloat. That's most important thing. And definitely in terms of spirituality, in terms of suffering, if you take, for example, religions like Buddhism, which I've also been reading up a bit on, which is perfectly like you got the divine rules and things like that, but I won't get too much in detail, which in terms of suffering, because I find oftentimes when we suffer in life, we think of it as an unnecessary thing. We drink, for example, or we do anything to numb it. We don't give reason to suffering, which I find if we do give reason to suffering, that will in itself create better mental health and mental strength. Because if you just drink, okay, let's say you drink, you smoke a joint or whatever to combat the suffering, there's no meaning to that suffering. But if you can like have the physical and mental strength to push through it, you can actually get some meaning and some worth out of that suffering, and in itself walk out a stronger, better, more healthier person. So definitely, I think, as you said, meditation, spirituality, is so many different things you can do to advance mental health and mental strength. And I definitely think the biggest thing is reading. I find that knowledge in itself, by getting access, we've got so much access to knowledge these days in terms of books and the internet. I feel just expanding one's knowledge and understanding of yourself, your brain, your body, the universe in general, you can truly create a dignified, strong, healthy mindset. That's just my take on things, my 2 cents right there in the pond.
Well, my dad has this thing where he speaks about the 5 whys analogy. I'm not sure if it's made up or if it was something he was taught, but boy, is it practical. So what you do is you pretty much have up to 5 whys. Let's go with your thought pattern, giving reason for your suffering. Why am I drinking excessively? That's the first why. Let's start there. It's because, I'm stressed. Okay, cool. There's reason too. Why are you stressed? I'm stressed because of work. Why are you stressed because of work? Oh, because I'm not performing as I should perform. Why are you not performing as you should perform? Because I'm still learning. And there's your solution. I'm still learning, man. Why did you do bad in that exam? Oh, because I didn't study. Why didn't I study? Because I'm lazy. There's your answer, So up to 5 whys, and it can consistently and consecutively, and you've got your answer. So that's a nice little thing I picked up, and it's done me some favors. I'm not sure whether you'll put that into your life, but I feel like it's handy to know. But I will now also say, so mental strength, I just mentioned, to define mental strength, it's the ability to cope with negative emotions in a healthy way. Now, with mental health, that is the presence or absence of a mental health issue. So now we will go to the fact of, how do you diagnose a mental health issue? Have you ever wondered if there's like a box you tick, or like a certain criteria you have to meet? Like, have you ever really considered how a doctor, a psychologist, a psychiatrist diagnoses someone?
Well, yeah, that's actually quite an interesting thought, and I have thoughts about it, numerous times, because you wonder to yourself, with mental health and mental disorders, it is such a broad spectrum. It's not, for example, like a fixed 5 or 6 symptoms. You could just like say, tick a box, we diagnose you. I think that is a big thing in itself. I find a way which works for me personally is also, I've brought up Dr. Jordan Peterson up a lot in this podcast so far, but I'm going to go out and do it again. As he said this thing, which I've tried now a couple of times, and I must say I find it to work it really works. Like basically what he says is, you should lay in your bed at night, okay? And you should think to yourself, what is something I'm doing wrong that I know I'm doing wrong that I can change? And oftentimes this answer, well, it won't be desirable to you. You might not want to change it. It might be excessive drinking or pornography addiction. It could be anything like you find is to your detriment. And you actually take active steps. I find it comes into awareness of yourself and who you are by knowing yourself better. Like I find oftentimes when we have a problem, we actually know what we're doing wrong in life, and we just like fail, or more or less just don't want to confront it or think about it.
Yeah.
But definitely I think becoming more aware of yourself, knowing what you're doing wrong, and taking active steps to change it, I definitely think that is the way. And you can use this in anything. I'm not saying overanalyze every spectrum of your life, but like, for example, let's say something is not working out for you the way, or you don't get the desired effect from what you're doing. You can everything, take the situation, think to yourself, okay, why did I fail? And I think that's also where those 5 steps can come in too. And you can think to yourself, what can I change? Not necessarily physically about myself, but how can I change my way of thinking and my way of approaching it in the future so I can get a better, more desired outcome?
The actual manual, quote unquote, that they use to diagnose someone, or as a guideline to diagnose someone, is called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5 manual, which was published by the American Psychiatric Association. So that's pretty much their guideline. The only difference is, if they say there's something wrong with you, or your body's check engine lights come on, a car has a manual to show you what's wrong with the car. A person, there's no copy paste method, man. There are an array of mental illnesses, like, just to name a few. You have the schizophrenia spectrum and psychotic disorders. You have bipolar and related disorders. You have depressive disorders, anxiety disorders, trauma and stressor related disorders, dissociative disorders. A very, very interesting one for me was called gender dysphoria. Now, what gender dysphoria is referring to, the distress that accompanies a person's stated desire to be another gender. So we'll leave that where it is, but we understand that this generation has a certain group of individuals who believe they have either been misgendered, or that they are not their current gender. And what could be seen as controversial is that now, according to what I've just read to you, that they could be suffering from gender dysphoria.
I find low self-esteem, I think, is probably a huge, contributing factor to that aspect. I've also read somewhere, actually, someone said that the most difficult thing to change in life is the way you see yourself. which really got me thinking in life, because like that's so true. It takes so much more effort, to see yourself differently through your own eyes. And I find getting a much better self-esteem and also more confidence is the biggest thing for me. If you can get some confidence in life, that can combat so many different things. Like I can really talk about this now, and you know what, I'm going to do it again, because I've recently read the 12 rules of life by Jordan Peterson, and now I'm going to exclaim now on the first thing, which I'm going to include again. You can't stop me. So what I'm saying is, why it is so important to have good posture and confidence in life. Like what he basically does is he links us to lobsters, which you take, for example, the life of a lobster. Like I'll summarize like his first rule now for you. Now, for example, a life of a lobster, they live literally on the bottom of the ocean, and whatever food falls from the top and stuff like that, that's what they eat. That's the life of a lobster. However, it can be a very dangerous life, because they have territory as well, and they fight with each other. And basically, when the lobsters come in the fight, the one throws the other one in the back, and the one that's still standing is the victor, and he gets all the lobster bitches. Which, if you put it as simply as that. But let me actually back seriously. Yeah. Now, the thing is, now with the lobster that is one, he actually extends his appendages and he walks taller. So basically, his brain chemistry is very similar to ours. It like releases so much dopamine because he has so much confidence, and the likeliness if he should get into a fight again, he'll win again, as he is the alpha lobster now. But basically, for the other lobster, which has now fallen on his back, sometimes his brain completely dissolves and it becomes like a new brain, but like how can I put this? Like a very, like it's almost like he's accepted his fate. He now sees himself as a lower ranked, well, lobster. And the thing is, as well, you would not bet for him to win another fight. And as well as he puts his appendages inwards, and the way he walks releases a chemical called oxypamine, which essentially is the direct polar opposite to what dopamine is. So, for example, he'll walk like that. And things like that, and he won't get the lobster bitches, as I mentioned earlier. So that's just the thing in life for me. It's like getting that self-confidence, that good posture in life. If you change the view and the way you see yourself, you can truly combat mental health. You can become like the lobster that's lost in life, and your brain can completely dissolve, and you create a new brain, which is just like accepting that you're no longer the alpha, or you can pump out those appendages, walk tall, and be the man. I think that's the biggest thing for me in life is, walking tall, having that self-respect, that high self-esteem. And that truly is the way I find you can get good, strong mental health and truly change the way you see yourself. So yeah, I'm going to conclude now with Jordan Peterson on this episode. But yeah, I think that was quite insightful also. So yeah, but I think that'll be another conclusion to another awesome episode of Finding Ballers. And I think we'll be back next week as we talk about our second segment containing health.
The world is quite literally our oyster. There's a boatload of content just in health alone.
Boats and hoes.
Boats and hoes. Whatever our topic is that we decide on, we're going to smash it. So then, take it away, Brendan. All yours, buddy.